Welcome everybody, my name is Dr. Andrew Gembo, I'm a medical oncologist, and welcome to episode 3 of Cancer 101 series, where we shall be talking about what are some of the common signs and symptoms of cancer. In case you missed my previous episode on where does cancer come from, please log into my socials and you'll be able to watch the video on YouTube, TikTok, Instagram, and Facebook. So let's get right into it. Cancer, what are the symptoms and signs of cancer? So it's important to note that early cancer will not have any symptoms. You will not feel sick. The cancer will be growing because it's very small. However, as the cancer grows bigger, you'll be able to notice a few things that could give you a clue that you could be developing cancer. I'll start with some of the general signs and symptoms of cancer. The first one is losing weight without trying, unintentional weight loss, excessive fevers and night sweats and fatigue that you cannot explain. Please go to the doctor. If you're suspecting you could be having a brain tumor, if you have very bad headaches that are not going away, prolonged headaches, any convulsions, any seizures, or any loss of vision, or any problem that you suspect is going on upstairs, you need to be checked. In the head and neck area, very commonly, sometimes you get neck swellings that you don't know where they came from, any nose bleeding that is prolonged, any stuffiness in the nose or blockages in the upper throat, or any wounds, sores, swellings inside the mouth or the tongue, they need to be addressed very quickly. If you come down to the chest area, if you have any prolonged cough or cough with blood, it doesn't have to be TB all the time. A prolonged cough without any explanation leads to a rising suspicion of lung cancer. If you have any difficulty or pain in swallowing, could be esophageal cancer. For breast cancer, we know all the symptoms by now. Any lumps, swelling, changes in the skin, nipple discharge, you should always go and be checked immediately. When you come down, lower in the abdomen, stomach cancer is very, very hard to diagnose, very elusive. It could be similar to H. pylori infections or acidity or reflux, because the symptoms are the same, yet you could be having cancer that is growing. So if you have these symptoms repeatedly, they're not getting better, you're taking medicine, they're not getting better, please ask to see the specialist. Liver cancer, always diagnosed late. You have yellow eyes, scratching, loss of weight, changes in color of your stool or urine. Don't wait for too long before you get checked. Colon cancer, again, a very difficult one to diagnose because the symptoms are very vague. If you have any drastic weight loss, drop in your hemoglobin levels, any problems while going for a long haul, straining, pushing, very constipated stools, very thin stools, and more importantly, any blood. When you see blood, extra when you see blood in your stool, no matter how little, it's not hemorrhoids all the time. So don't just ignore it. Please go and be checked. It could be one of the things that can help us to catch it early. When you come down to the productive organs, for the females, any bloody discharge, any foul-smelling discharge, any smells, any wounds in the private areas, they need to be checked by the specialist. We are here. We can do the examination for you. Don't sit at home with problems for so long. For men, any problems in the stream of urine, poor stream, straining, dribbling, and feeling like you're not emptying the bladder, it's not always just enlargement of the prostate. It can be prostate cancer. Go and be checked. Obviously, if you have any swellings in the penis, any swellings in the testes, they need to be checked as well. For skin cancers, any moles that are growing bigger, any wounds that are not healing, any changes you see in your skin that you don't know what they are, don't ignore. Don't just go to the chemist and get creams and apply. It could be cancer. Check the bottom of your heel, of your foot. Check the bottom for the black spots or melanoma, because you can't see them. When you're doing pedicures, check the bottom of your feet and look for those dark moles, because that could be an early sign of cancer. I may not cover everything exhaustively today, but I hope I've tried. For cancers of the blood system like leukemias, there are usually no lumps or swellings. You just get drastic drop in your blood levels, repeated blood transfusions, any spontaneous bleeding from under the skin and in your mouth, in your nose that you can't explain, or any repeated infections could be signs of leukemia. So you need to go to the doctor early. Childhood cancers might be a topic for another day because they have their own unique presentation, but I hope I've really encouraged viewers to empower yourself with knowledge about the signs of cancer, because sometimes it is you who will help us to make the diagnosis early. In my next episode, we shall be talking about how to make a diagnosis of cancer and what are the stages of cancer. So stay tuned and please like and share this video so that we can empower as many people as possible. This is Dr. Andrew Odhiambo. I'm checking out now.